Today, we're going to talk about a topic that affects millions of people around the world, which is hyperthyroidism. Do you know someone who has hyperthyroidism, or maybe you've been recently diagnosed with it yourself? If so, then you know how important it is to manage this condition. And one of the best ways to manage hyperthyroidism is through your diet. So, in this video, we're going to share with you the foods you should eat and avoid if you have hyperthyroidism. Plus, we'll give you some helpful tips on how to manage your symptoms naturally. First, let's talk about hyperthyroidism. This condition occurs when your thyroid gland produces too much thyroid hormone, which can cause a wide range of symptoms like weight loss, anxiety, insomnia, and more. The most common cause of hyperthyroidism is an autoimmune condition called Graves' disease. But did you know that what you eat can play a huge role in managing hyperthyroidism? That's right. Certain foods can actually help to balance your thyroid hormones and reduce inflammation in your body. And on the other hand, some foods can make your symptoms worse. So, in this video, we'll cover the top foods you should eat if you have hyperthyroidism, as well as the foods you should avoid. Now, before we dive into the foods, let's talk about a few tips to keep in mind. Did you know that stress can exacerbate hyperthyroidism symptoms? That's right, stress can increase inflammation in the body, which can make your symptoms worse. But if you're practicing deep breathing, yoga, or meditation, these techniques can help to calm your mind and reduce stress hormones in your body. Also, we'll talk about the top foods you should eat if you have hyperthyroidism. Did you know that some foods can help to reduce inflammation and balance your thyroid hormones? We'll tell you all about them. But, of course, we can't forget about the foods you should avoid if you have hyperthyroidism. Some of these foods might surprise you, and we'll explain why they're not good for your thyroid health. So, make sure to watch until the end to learn all about the best foods to eat and avoid if you have hyperthyroidism. How does diet affect hyperthyroidism? Eating certain foods will not cure hyperthyroidism, but some nutrients and minerals play a role in managing the underlying condition. The following nutrients and chemicals trusted source are among those that can affect hyperthyroidism. Iodine, which the thyroid gland uses to produce thyroid hormone. Too much iodine in the diet can increase the production of thyroid hormone. Calcium and vitamin D are vital because hyperthyroidism can cause problems with bone mineral density. Foods and drinks containing caffeine can worsen the symptoms of hyperthyroidism. Foods to eat. Number 1. Low iodine foods. If a person is planning to receive radioactive iodine treatment for hyperthyroidism, their doctor may ask them to follow a low iodine diet. A low iodine diet is a diet with less than 50 micrograms of iodine per day. Foods and drinks that are low in iodine include non-iodized salt, egg whites, fresh or frozen vegetables, herbs and spices, vegetable oils, sugar, honey, or maple syrup up to 2 tablespoons, jams or jellies, unsalted nuts and nut butter, lemonade, moderate portions of beef, chicken, turkey, veal, and lamb, fruit and fruit juices. Number 2. Cruciferous vegetables. Some cruciferous vegetables contain trusted source compounds that decrease thyroid hormone production and may reduce iodine uptake by the thyroid. Both of these effects may be beneficial for a person with hyperthyroidism. These cruciferous vegetables include Brussels sprouts and cabbage, kale and arugula, radishes and rutabagas, bok choy, cauliflower, broccoli and broccoli rabe. Number 3. Foods containing selenium. Selenium is a micronutrient that the body requires for the metabolism of thyroid hormones. Research suggests that selenium can help improve some of the symptoms of autoimmune thyroid disease, such as thyroid eye disease. Among people using anti-thyroid medications, those who take selenium supplements may achieve normal thyroid levels more quickly than those who do not. Foods rich in selenium include trusted source: Brazil nuts, fortified pasta and cereals, rice, egg whites, baked beans, oatmeal, spinach. Other selenium-rich foods, including tuna, halibut, shrimp, egg yolks, and cottage cheese are also high in iodine, which may affect iodine therapy. Eat fortified pasta and cereals, and rice made without ingredients that contain a lot of iodine. Eat limited amounts of beef, chicken, and turkey. Number 4. Foods containing iron. Iron is a nutrient that is important for normal bodily processes, including thyroid health. Iron helps the red blood cells carry oxygen to other cells in the body. Researchers have linked low levels of iron to hyperthyroidism. People can maintain an adequate intake of iron by including these foods' trusted source in their diet. Fortified cereals. Raisins. Dark chocolate. Beef, chicken, and turkey. Spinach. Some iron-rich foods are also high in iodine, which may affect iodine therapy. Make sure your total iodine intake is less than 50 microgram per day. Number 5. Foods containing calcium and vitamin D. There is an association between long-standing hyperthyroidism and decreased bone mineral density trusted source, which can lead to osteoporosis. Calcium and vitamin D are both nutrients that are important for bone health. Foods rich in calcium include milk, no more than once a day. Broccoli. Fortified orange juice. Kale. Bok choy. Many people with hyperthyroidism have vitamin D deficiency. The primary source of vitamin D is the sun hitting the skin so that the body can make its own. However, due to concerns about sun exposure and increased risk of skin cancer, many people actively limit their time in the sun or use sunscreen. Not many foods are good sources of vitamin D, but the following foods contain some of this vitamin. Salmon and tuna. Milk and some fortified dairy products. Fortified cereals. These foods are also high in iodine, which may affect iodine therapy, so you may have to limit these foods or make sure your total iodine intake is less than 50 micrograms. Look for fortified pasta and cereals, and rice made without ingredients that contain a lot of iodine. 6. Spices. Studies have linked certain spices, including turmeric and green chilies, to a reduced frequency of thyroid disease, including hyperthyroidism. Turmeric also has anti-inflammatory properties. People can use different spices, such as turmeric, to add flavor to their food. Foods to avoid. Number 1. Iodine-rich foods. Too much iodine can make hyperthyroidism worse by leading the thyroid gland to produce too much thyroid hormone. A person with hyperthyroidism should avoid eating excessive amounts of iodine-rich foods, such as iodized salt, fish and shellfish, seaweed or kelp, dairy products, iodine supplements, egg yolks. Number 2. Soy. Animal studies have shown that soy ingestion can interfere with radioactive iodine uptake for the treatment of hyperthyroidism. Sources of soy include soy milk, soy sauce, soybean oil. Number 3. Caffeine. Caffeine can worsen some symptoms of hyperthyroidism, including palpitations, tremors, anxiety, and insomnia. Where possible, a person with hyperthyroidism should try to avoid foods and drinks containing caffeine. So, there you have it, the top foods you should eat and avoid if you have hyperthyroidism. Remember, managing your diet is just one part of managing this condition, but it's an essential part. In addition to your diet, make sure to get plenty of rest, exercise regularly, and manage your stress levels. And of course, always work with your healthcare provider to create a personalized treatment plan for your hyperthyroidism. Thank you so much for watching, and make sure to subscribe to our channel for more health and wellness tips.